Hello everyone, welcome back to my channel. I am Shubha here. I hope you like this video. Please do like, share, comment and don't forget to subscribe. In this video, we'll discuss about the required evidences for self-assessment toolkit 5th edition for the standard COP 12. Standard COP 12. Procedural sedation is provided in a consistent and safe manner. Departments and the staffs involved in this activity are all clinical staff, medical staff, nursing staff, paramedical staff, infection control team, anesthetist and members of quality department. Objective element COP12 speaks about administering procedural sedation. Evidences: policy on use of moderate sedation with description on the scope, competency and administration protocols based on standard treatment guidelines or best clinical practices. Medical record with consent form shall demonstrate the usage of sedation in a consistent manner. Nurses monitoring record to demonstrate the advice and usage of sedation. Discharge criteria to be displayed should be condition specific. Objective element COP 12B speaks about informed consent for moderate sedation. Evidences: patient medical record to evidence the clinical condition and the requirement of sedation against the planned procedure. Informed consent form signed by anesthetist and treating physician. Objective element COP 12C speaks about competent personnel for moderate sedation. Evidences: credentialing and privileging document, doctors and nurses, specifically indicating that the nurse shall perform only under supervision and the technician shall not administer sedation. Personnel competency matrix with details of respective personnel qualification and experience. Training records to illustrate competency. Personnel record, personnel files with job description based on credentials. Patient medical record shall demonstrate that qualified and competent personnel are involved in sedation administration. Objective element COP 12D speaks about different personnel for sedation and procedure. Evidences: patient medical record to evidence that the person performing the procedure and administering sedation are different. Credentialing and privileges of doctors and nurses for clear indication specific to the respective personnel and to ensure that the nurse performs only under supervision. Personnel competency matrix to demonstrate respective personnel involved are suitably qualified and experienced. Objective element COP 12 speaks about intra-procedural monitoring. Evidences: patient medical record evidenced for a specific form to record the vitals and other parameters during the intra-procedural phase. Vital monitoring record shall be recorded under specific headings. Objective element COP 12F speaks about monitoring after procedure. Evidences: policy on after sedation monitoring processes shall indicate the scope and specific activity details. Patient medical record is evidence for a specific form to record the vitals and other parameters during intra-procedural phase. Vital monitoring template shall be used to record vital parameters under specific headings. Checklist or template to record the level of sedation, mild, moderate or deep, in an objective manner in line with standard guidelines. Objective element 12G speaks about criteria for discharge. Evidences: policy document on discharge criteria from the recovery room post procedure shall be evidence which will again demonstrate specific to the condition. Patient medical record to evidence the discharge from the recovery room is based on defined criteria for discharge. Discharge criteria to be displayed in the recovery room for easy reference and adherence. Patient medical record evidence for specific form to record the vitals and other parameters during the intra-procedural phase. Vital monitoring record shall be recorded under specific headings. Objective element COP 12H speaks about resource availability to revive patient from deep sedation. Evidences: patient medical record shall be evidence if there has been a condition where patients during monitoring have gone into a deeper level of sedation. Personal competency record to evidence that personnel monitoring such patients are suitably qualified and experienced. Credentialing and privileging of nurses and doctors should clearly mention the scope of work and accordingly ensure adherence. Emergency equipment checklist should available and equipment should be checked daily. I hope you like this video. Thank you for watching.